One of the things that I'm trying to unlearn as an attending is the emotional numbness, the apathy that comes with medical training. So much of medical school and residency and beyond is merely about survival. You are trying to just make it through this week, just make it through these next 6 weeks for this rotation, truly for the next 8 years. At least it felt like that for me. And you stay late and you do the extra procedure or research project, you get on some committee, even if you don't care about it a ton, because that's how you get to the next thing, to the next role, to the next pat on the back or dopamine surge from some award or whatever. And there's a certain emptiness that can come with that, because when you become an attending, you're looking at the rest of your life. You're not looking at the next 6-week rotation. And it's made me really appreciate the people who are also at their final degree of training, right? Nursing or APP or attending or whatever, in the little things that really mean a lot to me now. And I try to pay that forward, right? So like the nurse who's precepting someone who stays a little late to help them with doing a Foley for the first time, or the attending who stayed a little late to watch me do a central line after my shift, even if they didn't have to. And they're not doing that for an accolade. They're doing it out of the kindness of their own heart. And it sounds so flippant to phrase it that way. But even when people tend to do something nice for you in training, there's a reason there. They know what they're doing. They're trying to get that eval or that extra rep in a procedure so they can get credentialed to do it independently. It might be out of kindness, but there are ulterior motives very, very frequently in medical training. So I try now not to sweat the smaller things at work, because me doing small things for people really add up. The little, reassess a patient and discharge, just sign it out to me. Do they need an ultrasound IV? I don't care. I'm caffeinated, I'm ready to go. You just worked for the past 8 or 12 hours. And now instead of, the brilliant senior attending who might be the smartest person in the room, I'm trying to look more for the people who are respected for kindness. That's the kind of senior attending I don't want to be. I don't think I, throughout training, was ever the smartest person in the room, and it's not like I'm trying to be that person now. I think I'd much rather be the person who, when you walk in with your coffee in hand, that people feel happy that they think they're going to have a good shift, even if they're not